Hey, my friend, have you ever wondered what women really notice first when a man begins to lose his spark? Here's something women have privately shared with me in clinic conversations. When a woman pays attention, she often sees what men completely overlook, and sometimes what looks like aging is actually the body's early cry for help. According to national data, more than 65% of American women over 30 say they pay close attention to their partner's health, yet only 1 in 3 men schedule yearly checkups. Many guys think it's just stress or age, but 7 specific signs may mean your body is quietly saying goodbye to its prime, and could even be early HIV clues. Stay with me, because later I'll reveal a secret way to tell true aging from infection, plus the 60 to 6-3 testing rule every man should know. If this topic hits home, hit subscribe and comment 1. Stay until the end. I'll expose the year 1 mistake that makes men miss their golden testing window. Word count, 150. Let's move straight into the 7 signs women tend to notice first, and how a physician reads them through an immunology lens. In the US, remember, education here isn't diagnosis. If any sign feels persistent or unusual for you, schedule a proper checkup and labs with your clinician. Don't self-diagnose and don't delay care. Your health deserves clarity. Shortness of breath. Getting winded quickly. When effortless activities start to feel like uphill work, your physiology deserves attention. If an easy flight of stairs, a jog, or carrying groceries leaves you unusually winded, that is not just age by default. From an immunology lens, chronic low-grade inflammation raises metabolic load and blunts recovery. During acute HIV, some men experience a flu-like syndrome. Fever, body aches, swollen glands, sore throat, and a fatigue that makes simple exertion feel outsized. Differentiate fitness loss from biology. Ask yourself, did this change appear suddenly over a few weeks, despite sleep and nutrition, or gradually over many months with inactivity and weight gain? Do a 60-second self-check once a week. Note, resting pulse, perceived exertion with a brisk 2-minute walk, chest tightness, dizziness, night sweats, or viral illness. Log whether breathlessness pairs with other red flags like fevers, rashes, ulcers, or tender lymph nodes. If your heart and breathing no longer keep up with what used to be routine, that is a signal to look closer. Practical next steps in the US. Book a primary care visit, request vitals, labs, and if there was potential exposure, a 4th-generation HIV test at 3 to 4 weeks, then repeat at 6 weeks and 3 months. Do not self-diagnose. If symptoms escalate with chest pain or fainting, seek urgent care immediately. This is only the beginning. If you do not see yourself in this first sign, take a breath and feel relief. We will continue to sign 2, because patterns matter more than any single moment. Decreased desire. Losing energy after sex. A woman asked me a playful question in clinic, but the way she asked was serious. She said her partner had changed over the past 1 to 2 months. Less spark, more fatigue, and shorter stamina after intimacy. Testosterone depends on the hypothalamic-pituitary-gonadal axis. Chronic inflammation can disrupt that axis, flattening desire and recovery. In early HIV, the immune system works over time. Mood, energy, and sleep can dip, and libido often follows. Differentiate ordinary stress from systemic biology. If you slept well for a full week, ate balanced meals, and still felt flat, think deeper. If arguments, deadlines, and 4 nights of poor sleep preceded everything, that pattern points more to stress than to infection. Use a simple 60-second self-check after intimacy. Note: heart rate recovery at 5 minutes, night sweats, mouth ulcers, odd rashes, tender lymph nodes, or weight change. Clustered with low drive, these are red flags worth testing. If the change emerged suddenly within 1 to 2 months after potential exposure, schedule a 4th-generation HIV test at 3 to 4 weeks, repeat at 6 weeks, and at 3 months. In the U.S., do not self-diagnose. See your clinician for labs and STI screening. It's not just age. Sometimes it's a biological message you need to hear. Question: do you relate to this pattern? If yes, comment. So, I know you want more details tailored to this sign. If this area feels normal for you, comment OK, so I know to focus elsewhere next time. Difficulty urinating. The prostate under pressure. This one is rarely easy for men to talk about, especially face-to-face. A woman once told me about her husband. Lately, he didn't understand why his urination had changed. He described starting and stopping, a weak stream, a burning twinge, and waking up 2 or 3 times each night to go again. From a medical perspective, those are inflammation-driven signs. When the prostate or urinary tract becomes irritated, swelling narrows the passage and muscles strain to push urine through. Sometimes it's simple aging, sometimes dehydration or excess caffeine, but in some cases it signals infection. Sexually transmitted infections such as chlamydia or gonorrhea can inflame the urethra, and that inflammation opens the door wider for HIV to enter during contact. If these changes appear within days or weeks, not years, schedule testing for STIs and HIV at a qualified U.S. clinic. A 4th-generation HIV test at 3 to 4 weeks, then repeat at 6 weeks and 3 months, gives a clear window. Don't self-medicate with leftover antibiotics. That hides clues and complicates diagnosis. When the urinary tract talks, don't stay silent. Write down how often you wake to urinate, how strong the stream feels, and any pelvic heaviness. Share that record with your doctor. It helps identify whether this is benign prostatic irritation or something systemic. If you're not in this group, take a deep breath of relief. Comment "Continue" so we move on to the next sign together, because the story of your body is just unfolding. Irritability and mood changes. Guys, let me ask you, have you felt quicker to snap lately or found small things suddenly overwhelming? If yes, give me 60 seconds and you will see where you might stand. From the physician's lens, emotions are not random. When the immune system ramps up, inflammatory cytokines can tilt mood, concentration, and sleep. You may notice shallow rest, foggier focus, and a shorter fuse, even when work and family are stable. In early infection states, the body diverts energy toward defense. That shift can blunt serotonin and dopamine signaling, amplify fatigue, and make ordinary stress feel outsized. It is not weakness. It is biology asking to be heard. Differentiate mind load from systemic load. If 7 nights of solid sleep, hydration, and balanced meals do not restore your baseline, look closer. If irritability clusters with night sweats, mouth ulcers, rashes, tender nodes, or unexplained weight change, prioritize testing rather than guessing. Mental health is health. If these patterns persist, schedule your primary care visit and consider a therapist to calm the nervous system while we rule out medical contributors. Use a weekly 60-second check. Write down sleep hours, morning energy, patient score, and any physical flags. Patterns over 2 to 4 weeks tell the truth that single days hide. Share this segment with a friend or partner. Sometimes the caring messenger is not the doctor. It is you. Emotions can be a map of your immune system. Follow the signs, not the stigma. When the signals line up, listen before they get louder. Memory slips and vague fatigue. If you are under 50 and these symptoms ring true, I'm concerned. But stay calm. I'll guide you to solutions after we map the signs. In the acute phase of many infections, including early HIV, the body can mimic flu. Fever, body aches, mild brain fog, and lymph nodes may appear for a week or two. Here is the checkpoint that matters most: fatigue out of proportion to your workload. If a normal day leaves you drained and rest doesn't restore you, your physiology deserves a closer look. From an immunology perspective, inflammatory cytokines can disrupt sleep and memory consolidation. You may notice word-finding pauses, slower recall, and trouble tracking tasks you used to handle effortlessly. Differentiate overwork from biology. If 7 nights of good sleep, hydration, and meals don't reset your energy or attention, investigate. If this cluster aligns with fevers, night sweats, mouth ulcers, rashes, swollen nodes, or weight change, prioritize testing. Run a 60-second self-check each week. Rate morning clarity, note naps needed to function, track caffeine reliance, and document any viral-like symptoms. Patterns across 2 to 4 weeks tell the truth more than single days. Next steps in the U.S. Schedule a primary care visit, check vitals and labs, and if exposure is possible, use a 4th-generation HIV test at 3 to 4 weeks, then repeat at 6 weeks and 3 months. Do not self-diagnose or self-medicate. If your brain feels stuck in neutral, check it. Your mind is resilient, but it needs the right data and the right timing to recover. Constipation, dull skin, and unusual breakouts. Don't brush this off. Take 60 seconds in front of a mirror and ask, has my skin dulled? Are breakouts new? And has my gut slowed lately? If yes, you may be seeing the gut-immune-skin axis at work. From a physician's perspective, intestinal inflammation and liver strain can surface on the skin. When the gut barrier is irritated, immune signaling rises, hormones fluctuate, and oil production shifts, producing constipation, bloating, uneven tone, or acne that doesn't match your usual pattern. Differentiate lifestyle noise from biology. If fiber, sleep, and hydration were decent, yet constipation and skin changes appeared over several weeks, think beyond convenience foods or an extra drink. Clustered signs matter more than any single pimple, especially when energy feels unusually low. Run a weekly 60-second check. Note stool frequency, effort, abdominal discomfort, new rashes, mouth ulcers, itch, or yellowing eyes. Track alcohol, new supplements, antibiotics, or gym changes. Patterns reveal whether this is routine disruption or a systemic signal worth testing. Basics that work. Aim for 25 to 38 grams of fiber daily, 2 liters of water, steady sleep, modest alcohol, and sunscreen. Rebuild the skin barrier with gentle cleanser and fragrance-free moisturizer. If symptoms persist, schedule primary care and labs, including liver enzymes. You might be run down. But if gut and skin are both talking, it's time for a comprehensive check, including STI screening and, when exposure is possible, a 4th-generation HIV test on the 60 to 6 to 3 timeline. Skin and gut often whisper before the body has to shout. Rapid hair loss and prematurely aged skin. Reaching this final sign, I want to be direct and clear right now. Hair thinning fast and skin looking older than your years should not be dismissed as just age. In most men, these shifts appear after 50 or 60. Showing up earlier is a warning light. From a physician's view, chronic inflammation and poor cellular nutrition slow hair cycling and collagen repair. Iron, zinc, vitamin D, thyroid imbalance, and chronic infections can nudge follicles into rest. When the immune system is busy, energy is reallocated, and hair, skin, and nails pay the bill. Differentiate pattern loss from illness. Male pattern baldness recedes at the temples and crown, often with family history. Illness patterns thin diffusely, shed handfuls after showering, or pair with brittle nails, itchy rashes, or dandruff. Run the 60-second weekly check. Note hair shedding on your brush, scalp tenderness, eyebrow thinning, or beard patchiness. Document skin changes, sallowness, creases deepening fast, slow-healing nicks, or acne that feels unusual. If these changes surfaced within 1 to 3 months, especially after exposure, add medical testing. Ask your clinician for a focused exam, basic labs, thyroid panel, ferritin, vitamin D, and when indicated, STI screening with a 4th-generation HIV test on the 60-6-3 timeline. When your face tells a fatigued story, ask why. Root causes are treatable early. Appearance often improves as physiology normalizes. If none of today's signs fit you, I'm glad. Drop a funny sticker in the comments so I know you're doing fine, and let's continue to the solution. Listen closely. I will compress this into 90 seconds so you can apply it and teach family carefully. Here is the promise delivered: a clear way to separate natural aging from early HIV signals, and a simple plan to follow today. Layered distinction, Step 1. Timing. If clustered symptoms appear quickly within 2 to 4 weeks after a potential exposure, think acute HIV. If changes creep in gradually over years with lifestyle drift, you are more likely seeing aging. Layered distinction, Step 2. Clustering. When 3 or more groups show at once, fatigue, low fevers, swollen nodes, rashes or mouth ulcers, unintentional weight loss, testing takes priority over guessing, because pattern density matters more than any sign. Layered distinction, Step 3. Response to rest. If 1 to 2 weeks of solid sleep, protein, hydration, sunshine, and reduced training do not restore your baseline, schedule labs and screening. Biology speaks louder than stress, and timing makes all the difference. Now, the 60-6-3 testing rule. Do a weekly 60-second self-check, track energy, sleep quality, skin and gut signals, urinary changes, and libido. At 3 to 4 weeks after exposure, do a 4th-generation HIV test. Repeat at 6 weeks. Repeat again at 3 months to close the window. Exposure within 72 hours deserves urgency. Ask your clinician about PEP immediately and set reminders for follow-up labs. If your risk is ongoing, discuss PrEP as prevention that works silently in the background when you keep your appointments. Repair the barrier, reduce the highway for infection. Treat STIs early, moisturize after showering, use gentle cleansers, lube with condoms, and let irritated skin heal before friction. Small skin decisions prevent microtears and lower viral access. Lifestyle reset. Practical and American. Sleep 7 to 8 hours. Aim for 25 to 38 grams of fiber, hydrate, limit alcohol, lift smart, and get daily sunlight. Your immune system loves rhythm more than intensity, and rhythm is teachable. If you want deeper help, comment the rule's name, 60-6-3, and I will tailor the next lesson for you. Next up, a 100-word case snapshot that shows why the right test at the right moment saves 6 months of worry. Mark, 31, worked 2 jobs and blamed getting older for his fading spark. After sex, he felt unusually drained. New jawline breakouts appeared, and nighttime trips to the bathroom multiplied. At 4 weeks post-exposure, a 4th-generation HIV test was negative, but we scheduled repeats. 6 weeks later, the assay detected early infection with a low viral load. We started treatment immediately and built a simple routine: sleep, fiber, hydration, gentle training, and a weekly 60-second check. His girlfriend joined every visit, practiced talk test trust, and anchored his calm. Within months, he reached truly undetectable, you, and his energy, intimacy, and confidence returned fully. So don't panic just because you noticed a few changes. If at least 2 of these signs last longer than 2 weeks, don't label them as aging. That's your cue to pause, check, and act early. Comment "I choose clarity" if you want me to make a dedicated video explaining the 60-second home checklist and US testing guide. Let me share a personal view, and I understand not everyone will agree. But this is what experience with thousands of men and couples has taught me. In America, the core mindset is simple. Talk, test, trust. Open conversation first, testing second. Trust always. Silence never prevents disease. Clarity does. When you speak with your partner, skip blame and start with honesty. Use a calm tone. I care about us. I just want both of us healthy. Agree on a regular testing rhythm, the same way you schedule workouts or pay bills. Health checks are maintenance, not judgment. Face reality. Only by facing it can you move through it. When you avoid it, anxiety grows in the dark. When you test, fear loses its power. Normalize men's health care. See your urologist for function, your primary care for labs, your sexual health clinic for STI screening. Those visits don't question masculinity. They protect it. Talk, test, trust. That is how responsibility becomes freedom. Here's the 5-point formula, gentlemen. Simple but powerful. Sleep 7 to 8 hours. Protect the skin and mucosa. Treat every STI early. Follow the 60 to 6-3 testing timeline. And keep a 60-second weekly journal of your body's energy and signals. Thank you for staying with me to the end. You showed care for yourself and for the people who count on you. Here is the clean recap. 7 signs women often notice first: unusual breathlessness, lower desire and quick fatigue after sex, urinary difficulty, irritability and mood shifts, memory slips with vague fatigue, constipation with new skin changes, and rapid hair thinning or prematurely aged skin. Use the 3-layer distinction we covered. Ask when the pattern began, whether at least 3 signs cluster together, and whether 1 to 2 weeks of real rest fails to restore your baseline. Timing and clustering beat guesswork. Follow the 60-6-3 timeline. Do a 60-second weekly self-check on energy, sleep, skin and gut, urinary changes, and libido. Test with a 4th-generation assay at 3 to 4 weeks after exposure. Repeat at 6 weeks, and repeat again at 3 months to close the window. If exposure happened within 72 hours, do not wait. Ask your clinician about PEP immediately and commit to follow-up labs. If a risk continues, consider PrEP as quiet protection. Treat STIs promptly and protect skin and mucosa with gentle care. Use condoms with lube, moisturize after showering, and let irritated skin recover before friction. Small barriers prevent big problems. Remember the destination. Early treatment drives the virus down to undetectable levels. You got you means undetectable equals untransmittable, and it restores health, intimacy, and confidence. One subscription from you today can deliver this message to the person who needs it tonight. If this video steadied your nerves, share it with a male friend. Together, we replace fear with clarity. I am proud of the decisions you made. Keep your notes, book your checkup, and carry the habit forward. Talk, test, and trust. Your future self will thank you.